My name is Vijaya. I am the Senior Director at Singhealth. I thank you for this opportunity. I am here to talk about Singapore health in general and our experience in Singapore. First of all, I want to congratulate all of you for what Singapore did in the some of the suggestions was about setting up a centralized body, such as we have on Singapore medicine, which was very much and also Singapore join hands together, put the private and the public sector together, so that we jointly put our capabilities and people have a choice to decide where do they want to go. Having said that, it's a very small country. Our regulations are very, you have heard about Singapore regulations, be it on visa, on even tourism into different we have to follow regulations. That is countries that we for Singhealth, what is most important is patients of all regions. So, for us from Singhealth, medical is the most important component of the tourism. The reason being, it is a very safe, high quality, good transport, and the government has taken care of all the requirements for the people to make it any travelers who want to visit. I'd like to share with you that Singhealth had policies in place patient irrespective of whether it is a traveler or in Singapore. As I said, we are a public and we proud to be public. Everybody is treated equal. Require additional support in terms of travel, or other support services taken care of as well. So we want to be the choice for a medical destination first. And so my talk is I'm going to share about what we have in place for everyone to see and to experience as a medical destination. First of all, my first slide, if I'm not sure if it can be brought up here, it's an overview on the healthcare system in Singapore. We are Singhealth, the largest public sector in Singapore. We also have other clusters, which is called the National University Cluster, and we also have the National Healthcare System Cluster. Under Singapore Health, that is our group, we have 2 tertiary level hospitals, which is the Singapore General Hospital. This hospital has about 200 years history, nearly 198 years history. And if you come to this hospital, nothing looks like 200 years old. It's the most modern, highly sophisticated, highly, with entire facilities available in this hospital. We also have KK Women's and Children's Hospital. I think this hospital is also very well known for services for women and children. We have a community hospital, which is again talking about our system. Once the acute care level diminishes, the requirement of acute care level diminishes, we actually discharge the patient to the community. This is only, of course, for Singapore patients. We also have the national specialty centers. And now this is the importance of Singhealth. The reason being, all these were departments under Singapore General Hospital. Based on the requirement of the country, the demographics, the disease patterns, we started developing national centers of excellence. The centers of excellence provided an opportunity for other people in the region to come and actually experience what we do. We do a lot of research, we do a lot of education at these centers of excellence, of course, including in Singapore General and also in in KK Women's and Children's Hospital. We have 44 main specialties, and we have more than 142 subspecialties. Now, this is the reason why we say medical is most important. People who are looking around, shopping around, may want to see what is available in the setup. Some centers may be good for certain things, but since we are a public sector and we take care of Singaporeans, we have established the entire length and breadth of subspecialties. So when people are looking for a particular subspecialty, these days people are very intelligent. They go up, they go on the website, they go on the Facebook, they look what is available. They also follow the clinicians. They look at the clinician's profile, see how many surgeries or what kind of training this doctor has had, and they follow the doctors as well. So we have created up to 142, 46 specialties, and it's still growing, and that makes it interesting for people. Whoever wants to come, they're most welcome to come and see a subspecialist. We have all of our specialists are internationally qualified. Singapore has medical colleges, but for those people who want to be trained, we send them overseas. So more than 75% of our doctors, we have a pool of more than 2,000 doctors, more than 70% of them are trained internationally. And this is just a snapshot. We look after more than 33.7 million patients visit per year. I know countries like India, even Sri Lanka, these numbers may not mean many things because maybe even one particular center may be doing so many cases. But I must, I must be reminded and remind everyone, Singapore is a small country with a population of over 5 million. We do about 300,000 surgeries per year, and we do have network of primary care units as well. Am I clear? Is things okay? All right. JCI has been spoken of. JCI has been very well spoken of in the morning. And I must also establish here that Singapore General Hospital is the second largest hospital in the world to be JCI accredited. And yes, across the entire healthcare system, nursing, allied health, administration, and the entire process is JCI accredited. And in fact, I think we're so large, sometimes the auditors do come here and, they actually talk to us about how can we improve the system itself. And sometimes we have the knowledge of sharing our experience because of we are quite large. And we have been re-accredited, and we have actually scored nearly 99.9% every time. So I'm talking about this because I think it is just not about getting the JCI accreditation to tell people whether it's making a difference to the patient's lives. And I think that's the quality standards that we want to follow. And we seek feedback. Quality is very, very important for us. We engage the patients and their families to give us feedback about our work. And that is very much a part of the JCI re-accreditation for us. Our KK Women's and Children's Hospital has also been JCI accredited, and all our national centers. So the experience for a patient is complete. They don't have to go to one ward and feel, oh, this ward was very good. I went to another place and I think that was not excellent. So the JCI gives them a patient experience, and we're very, very happy about that. And the three pillars that I would like to share for Singhealth is patients, education, and research. So you see here, we are not talking about medical tourism. Whoever comes through us, we actually offer them the latest. We do a lot of research in our organization, and perhaps patients are coming here because they think that our doctors are able to find, our clinicians are able to find new evidences and new treatment protocols, especially treatments like cancer. Every day there's something new happening. And I think those kind of things people do follow a lot. And again, we do have an international medical service that provides, morning I was hearing one of the speakers talking about language skills and, making them comfortable. Absolutely. I think the soft skills are very, very important. We try and establish, we bring in people from the respective countries who can speak the language, maybe from Myanmar, from Vietnam. For us from Singapore, we do see a lot of people from the neighboring countries, Indonesia, Malaysia. even from the Middle East. Again, they come here not for minor surgeries, minor operations. They come here for very multidisciplinary approach and something more complicated, and that's how they come to Singapore. Yeah. I'm just quickly sharing with you on Singhealth. I said we have 44 clinical specialties, and that's our Singapore General Hospital and KK Women's and Children's Hospital. I see you can't see the slides up there, so I'm just running through this. We have our National Cancer Center, National Heart Center, National Dental Center, and the National Neuro Center, and also National Eye Center. All these centers of excellence work together with Singapore General Hospital. There's a lot of cross reference. Once the patient comes through one of these centers, and if they have to be seen by another subspecialist, it's very easy for us. It's the teamwork and it's a multidisciplinary approach. So it's easier for us to connect. The patients do not have to go outside anywhere else. They are with us, and it's quick. I mean, the international medical team does a very good job of connecting, and they complete the process for them. And this experience, we have had a lot of feedback from our patients that they found it very useful, especially those patients sometimes where the diagnosis has been very difficult in their own country. They have tried their own country's specialists, and because they would require a multidisciplinary approach, maybe they were not finding a cure for what they had. So this approach has made it very significantly very important for us. And I'm talking about, very importantly here, is the National Cancer Center Singapore, where we have a tumor board meeting for every patient. There is imaging department, there is a medical oncology team, there's a surgical oncology team, radiation oncology team. They discuss every case together with a palliative physician, a nurse who is trained, a medical social worker, and the whole works. The reason being, the support given to a cancer patient is very, very important. And it does not matter whose case is it. It might have come through a medical oncologist, but if the patient is benefiting first from a surgical oncologist, the surgical oncologist does the bit first. So we propagate this. In fact, we do have a lot of teams coming from the region to come and actually learn this kind of work from our National Cancer Center. We also focus on learning and training. We welcome partnerships and collaboration. In fact, my division is known as the International Collaboration Office. The reason being, we like to share, we like to work with teams, for the simple reason we believe that there's a lot of shared care that's possible. I heard one of the speakers talking about, yes, the treatment takes place in a different country, but perhaps the patient goes back to your own country and you require a lot of follow-up support. So a doctor-to-doctor communication, networking with the doctors and talking to the doctors would be very helpful. And we can share, of course, we have something called PDPA in Singapore. Patient confidentiality is a very important thing. So I think a clinician-to-clinician sharing would be very good as a progress to help the patient recover better. We also have a lot of research collaborations. We have a very big research portfolio. And the research that we do, again, is transferred into treatment protocols for patients. And so we do see a lot of people asking us questions about whether they can seek treatment because of this advanced treatment. So again, I would like to conclude by saying patients are the heart of all we do. And we are here to provide healing environment and a healing protocols for patients. And we would like to also provide a future healthcare for all the patients who go through us. So we are public and we are very private. We are very, very proud about it. Competition, no competition. People come if the medical, clinicians are good, the service is good, and we have a very good quality standards, peace in the state and in the country, and good standards to follow, and including good regulations. Thank you very much. I'm prepared to take questions after the speakers have done. Thank you.
Yes, thank you very much for sharing the Singapore experience with us. And